Hi, my name is Mridu Karanam, and I'm a rising senior at Eastlake High School. During my time at SSF, I researched ambulatory orthopedic surgery in pediatric patients and conducted a reevaluation of whether these surgical procedures should still remain ambulatory. So first, what is ambulatory surgery? These are surgical procedures that don't require an overnight hospital stay, so it's less than 24 hours, and they're thought to be cost-effective and efficient for both the hospital and the patient, but I'll be touching on more of this later. The safety is well documented with low rates of adverse events during or immediately following the surgery, but there hasn't been that much research on the long-term effects. And the consequences of ambulatory surgery during an extended period of time hasn't been studied extensively, as I said before. So the aim of my research is to reevaluate which pediatric orthopedic procedures should still be considered ambulatory surgeries by looking at various factors. So this includes the readmission rate, so how many patients are being readmitted into the hospital after they experience their procedure, and any postoperative complications that they have, and the cost of each procedure. So I hypothesized that currently many ambulatory pediatric orthopedic surgeries cause long-term postoperative complications and should not be ambulatory procedures. My thinking behind this was that since they're same day and there's no post-op appointment, no follow-up, some of the complications can go unseen, and these patients won't be receiving the adequate care that they need to stop these complications from happening. So my methods included a literature review, meta-analysis, and various patient studies. All of these studies were from 2009 to last year, and the purpose of using all of these methods was to analyze the cost and postoperative success to infer which procedures should still remain ambulatory. And my exclusions from this were people that were older than 18 years because I was only looking at pediatric patients. And I also excluded anyone with any prior disease, infection, or trauma that might have affected the outcomes of their post-op follow-up. So first I looked at, is ambulatory surgery actually cost-effective? So in my first study, it concluded that direct intraoperative costs for low-risk pediatric orthopedic procedures were lower in ambulatory surgery centers. But the study did not provide costs from other phases of care or any indirect costs. So if the patients are coming back to the hospital and receiving any other care. However, in other articles that I looked at, including the second one on the screen, I found that direct cost savings were prevalent in these ambulatory surgeries, so 17 to 43% of direct cost savings took place. And these surgeries had very low readmission rates, with almost only 2.5% of patients being readmitted. However, it had high rates of success, it was still flawed because these procedures did not provide adequate pain control in the perioperative period, which means from when the patient is admitted to when the surgery is taking place and after the surgery is done. So after this, I wanted to look more at the pain control in the postoperative period, and I found that generally 44.4% of pediatric orthopedic patients experience moderate to severe postoperative pain. So this is a very large amount of these general patients that are going through orthopedic surgeries. And one thing interesting that I found was that opioid overprescribing is actually common after non-ambulatory pediatric orthopedic surgery. So when the patients are staying in the hospital after multiple days, they're receiving so much more medication than they need. But in ambulatory pediatric orthopedic surgery, these patients aren't receiving as much medication as they should be. This is supported by my next study. This was a controlled study including 261 children from 2 to 12 years of age undergoing surgery, and this study was measured using PPPM. So PPPM is the Parents Postoperative Pain Measure, and it's basically a 15-item questionnaire to evaluate pain in children. So 15 is the child is experiencing the highest amount of pain, and 0 is no pain. So in this study, I specifically looked at day 3 just because there was the largest discrepancy between the amount of children that were experiencing pain and the amount of children that were receiving medication. So 67% of children experienced significant pain on this day, and 41% of those children only received 1 or 0 medication doses. And low, moderate, or high PPPM rated children had no significant differences, meaning that a child with a PPPM rating of 15 and a child with a rating of 0 received the same amount of medication, which is basically 0. And to see if this was prevalent in other studies, I looked at another study which enrolled 204 patients. And some background that this study provided was that 44 to 93% of patients experience postoperative pain, and above 50% of patients experience postoperative maladaptive behavior changes, or PMBCs, after 2 weeks. So PMBCs were included in this study, and these are speculated to be expressions of postoperative pain, but they aren't exactly proven yet to be, but they are still harmful to the child and the patient that's experiencing them. And 20% experience persisting PMBCs for over 6 months. And the results of this study included post-op pain is experienced by 68% of patients, but this was only for 2 to 3 days. And the pain range included 44% of them experiencing mild pain, 18% experiencing moderate pain, and 6% experiencing severe pain. And only 17% experienced pain after 1 to 2 weeks, which was different from my last study, which included 67% of patients experiencing pain after 1 to 2 weeks. But PMBCs occurred in 20% of patients with a PPPM score of 0. So there wasn't really any connection between the patients that were experiencing pain and the patients that were experiencing these PMBCs. So for my conclusion, I concluded that ambulatory pediatric orthopedic procedures are cost-effective and they have low readmission rates, but they do lack adequate postoperative pain management and the regulation of PMBCs. And with this information, I concluded something very different from my hypothesis, and I think that they should remain ambulatory surgeries, so they should still be same day, but there really needs to be more instruction on postoperative pain management for parents so that they can accurately give their children the amount of medication that they need. And more research on PMBCs is needed because although postoperative complications aren't really common, these PMBCs are. These are my references, and thank you to my fellow interns, Dr. Pierre, visiting physicians, my family, and faculty.
That was great. Thanks so much. I think you did a really nice job. What I liked about your topic and your presentation was that you hit on 3 really big things that are important in clinical research. You looked at what are we doing the right things for the patients, what's the cost effectiveness, and all of those things are really important when you're designing research studies that you can get funding for. So I think you have a really bright future ahead of you. When you're a pediatric orthopedic surgeon, are you going to be yourself unwilling to work in an ambulatory surgery center? And are you going to want to keep everybody overnight to check on them? Or do you think that you're going to find a different balance?
I think if I was only working with pediatric patients, I think I would keep some of them overnight, just because with the prevalence of PMBCs and because there isn't that much research on them, and also with the fact that a lot of them aren't receiving medication, I would like them to stay in the hospital for 2 to 3 days. But in adults, I would probably just send them home because ambulatory surgeries they're cost effective and they're great, but it's just that in pediatric patients, when you're an adult, if you experience pain, you can get that medication yourself, you can drive yourself over to the hospital. But with children, they kind of have to advocate for themselves and, express to their parents what they're feeling, and parents have to be very intuitive. So I feel like I would not keep them do ambulatory surgery.
It's a very conscientious answer. Thanks for putting that together. That was great.
Thank you.